rhesus incompatibility and the ramifications in a marital relationship. Okay, so let me quickly go to the science of rhesus factor. We still have time to discuss. Let's go to the science of rhesus factor. Now, what is rhesus? Rhesus is a type of protein on the surface of the red blood cells. I'm sure when people ask you what is your blood group, some of you say O positive, B negative, and stuff like that. Now there are two ways of classifying blood group. You have the ABO system, which is quite common. So when you say I'm B, I'm O, you're talking about the ABO system. But when you say positive or negative, you're talking about the rhesus factor. So every one of us has a particular class that it belongs to. So you can either be O positive or negative, B positive, B negative. So as concerns rhesus factor, you can either be positive or negative. Now you are said to be positive if you have this protein on the surface of your red blood cells. But if you don't have it, you are said to be rhesus negative. I have a diagram to that effect. So if you can just come up now. Yes. So you see that thing that looks like Y shape that can qualify as a protein on the surface of that red blood cell makes it rhesus positive. But if you don't have it, you are rhesus negative. Now it will interest you to know that most persons are rhesus positive, and it's quite a small percentage of people in our population that are rhesus negative. It's difficult really to get the actual statistics, but in a particular study in the US, it's known that just about 15% of the population are rhesus negative, but about the vast majority of the people are rhesus positive. In Nigeria, it's even less. I saw a study that said just around 5 or 6% of people are rhesus negative. Now, the importance or significance of someone's red status in terms of the rhesus factor comes into play is of medical importance for females who are pregnant or who plan to have children in the future. But other than this implication in pregnancy, rhesus positive antibodies circulating in the bloodstream of a negative woman doesn't really have any adverse effects to the woman herself. But its implication is when the woman now wants to be pregnant and conceive. So the concern about rhesus factor is when the woman is negative. If the woman and then married to a spouse or has a spouse who is positive, if the woman is positive and the spouse is negative, there is no concern about that. It's important we take note of that. If the man is rhesus negative and the woman is rhesus positive, there is no concern about that. But if the woman is rhesus negative and then the husband is rhesus positive, then there are some concerns about that. Now, the concern is not strong enough to prevent them from getting married. I think I mentioned that somewhere. Yeah, it shouldn't prevent them from getting married. But however, it requires that extra care should be observed and given when the woman becomes pregnant to prevent an event that we call sensitization. Now, what is sensitization? Somebody who is rhesus negative, like let's say a woman who is rhesus negative, if she gets exposed to blood that is rhesus positive, because she doesn't have those antigens in her body ordinarily, what her body does is that it will begin to manufacture antibodies that will attack those antigens that she just got exposed to. So, for instance, a woman who is rhesus negative and the husband is positive, she becomes pregnant, and then that child, that fetus is rhesus positive. So that child has rhesus positive cells in the blood, in his blood. Let's assume he's a male fetus now, in his blood. But the woman has rhesus negative blood circulating in her own system. Now we know that in utero, the child draws most of the nutrition from the placenta, which is attached to the mother. Now, towards the third trimester, and particularly during delivery, there can be some exchange of blood or some contact between the child's blood and the mother's blood, what we call fetal-maternal exchange. And so, if those red blood cells of the child that has those rhesus antigen comes in contact with the mother gets sensitized. Sensitized means that the body begins to detect, no, there is an external thing that has come into this space. We need to protect ourselves. So they begin to manufacture antibodies, which are like soldiers of the body. What do they do is that their intention is to clear out those things that are just in that. Now, because most of this exposure, this fetal-maternal exchange of blood occurs during delivery, the mother is sensitized, but then the child is delivered just before the antibodies are fully produced. So the first child will escape if the woman is sensitized. Their first delivery, that first baby escapes. But in subsequent pregnancies, if the woman takes in and then that baby is rhesus positive, then because the mother already has circulating antibodies against that rhesus positive cells, those antibodies will cross the placenta. They can cross the placenta, they will cross the placenta and attack that baby in the womb. And so you see the woman having recurrent fetal death, intrauterine fetal death or miscarriages. And it will be happening repeatedly because once somebody has gotten sensitized, it is for life. And so that is why I did say that the concerns of incompatibility in rhesus is not enough to prevent them from getting married. But extra care and caution should be observed when the woman becomes pregnant to prevent sensitization. It's important to prevent it because once it occurs, their reproductive capacity becomes compromised, and it takes a miracle really for them to have a healthy offspring, unless the child is rhesus negative. So I will talk more about when I get to my recommendations. I will tell you what to do. When I talk about observing extra care and caution, I will give you the specifics of what we should do in that regards. Okay, yeah, I think I'm at that point now. So having gotten this basic knowledge, I'm sure I've tried to give us an overview of the science of both genotype and then the science of rhesus incompatibility. Now, having understood this science, what we can then make our recommendation, our prescription. The first thing I would have to say is to each and every one of us is we should know our blood group and our genotype. I know I'm talking to people at various stages of their life. Some of us are already married, some have kids already, some are just about to start the journey, some will yet start that journey. But rhesus negative women with rhesus positive spouses should register for their ANC in a facility that offers quality obstetric services and constantly remind them that you are rhesus negative. Let me emphasize that. So if you know your blood group that you are negative, you might say O negative, B negative, A negative, and all that. That means that negative means that you don't have rhesus factor, so you are rhesus negative. You need to register for antenatal in a facility that has a capacity to offer you quality obstetric services. And what do we mean by that? Where there are trained health personnel, people that understand these concepts and the implication it can have on your reproductive potential and capacity. So you need to do that. And on your own, remind them constantly that you are rhesus negative. So that the common practice, particularly in our country, Nigeria, is that as soon as you deliver, within 72 hours of delivery, you should get an injection. That injection is called Rogam. The function of that injection is that it prevents the woman or the mother in this instance from getting sensitized to those rhesus antigen on the child's blood. Let me repeat that again. If you're rhesus negative and your husband is rhesus positive and you get pregnant, register in a facility that has the capacity to understand these concepts and can assist you in that regards. Now, if you give birth within 72 hours of delivery, the earlier the better, you should get an injection called Rogam within 72 hours of giving birth. Now, what I remember when I was still practicing at home, that is a costly injection. So one way we used to ask those when we try to take history whether they got the injection in their previous deliveries, ask them, are you giving that costly injection? Because as at then, I think when I was in your service, a shot of it was around 30,000 or so. I don't know the amount now. So usually the patients will have to make special provision for that and just keep it handy so that as soon as you deliver, you get the injection. And that's the practice back home. But there are some recommendations. In some other, what we call international best practice recommends that the woman should get at least one shot of it in the third trimester of pregnancy. The pregnancy classically is divided into first, second, and third. So 13 weeks. So from upwards of 26 weeks, the woman should get a shot of this Rogam, if possible. There are financial implications because it is believed that there are some transplacental bleed in the third trimester. That is, blood can actually cross from the baby to the mother. But the quantity, some authorities have argued, is not enough to elicit sensitization. But most of the exchange that is enough sufficient to elicit sensitization occurs during delivery. And that's why most persons emphasize on you getting that shot after delivery. But if it's possible to, if you can afford to get it in the third trimester of pregnancy, that is fine. It's also important that if any incident occurs during your pregnancy, like if you have a miscarriage, you should get Rogam. If you're involved in an accident where you received a trauma to the abdomen, maybe you are struck in the abdomen or you bashed your abdomen into something, you should get Rogam. If you undergo some procedures like amniocentesis, it's not commonly done anyway these days. Some external cephalic version, when your baby, they try to manipulate the baby into the cephalic position when the baby has breech presentation, is not commonly done too. Or maybe a transfusion accident. That is when somebody, you are O negative, and then you are giving O positive blood. It's assumed to be a transfusion accident. So if you are pregnant and these events happen, you should also get a shot of Rogam to prevent sensitization.
I want to share with us a story of a woman we managed in the hospital. She came with a history of recurrent miscarriages. And by the time we took the history, we discovered that during her early age as a spinster, she got pregnant and had the child aborted. But unfortunately for her, she's rhesus negative. And then unfortunately, the person that impregnated her was rhesus positive. So she aborted the child without knowing she has already been sensitized. and she didn't take this program because the abortion was done in a local way. Now she has moved on with her life, and currently she's married to another person, and currently she can't have a child again. She's having recurrent miscarriages. So when we probed, we discovered that this woman has already been what? Sensitized already. So these are issues. So it therefore means that even in cases of miscarriages, one should endeavor to take this program. It is very, very important. I believe we got the message I just passed now. So while we look at the questions, so over to you, Dr. Emmanuel. Someone asked, you made emphasis on rhesus negative mother and rhesus positive father. What if the father is rhesus negative and the mother is rhesus positive? Is there any cause for alarm?
Okay. Okay, thanks for the question. No, there's no cause for alarm. I did emphasize that the concern, as concerned particularly with the subject of rhesus factor, is if the woman is rhesus negative. I said that the larger percentage of the population, they are rhesus positive, so they have that rhesus antigen on the surface of their red blood cells. But there are a few persons who don't have it, and those are the ones that are rhesus negative. So because they don't have that the rhesus antigen, they tend to produce antibodies against those red blood cells, those rhesus red blood cells, when they are sensitized. So if somebody is rhesus positive, that means the person already has rhesus antigen, so he or she won't produce antibodies against the red blood cell that contain rhesus on their surface. So no, if the husband is positive and the man is negative, there is no cause for worry. There's no cause for worry. The reason is because a woman who is positive has the antigen, but if the husband is negative, he doesn't have, so there's really nothing for the woman to react against. But when you switch it the other way around, the woman is negative, the husband is positive. The husband has the antigen. Negative means that she doesn't have the antigen. Positive means that she has the antigen. So if the woman is negative, she doesn't have it. She doesn't have the antigen. So the body will produce antibodies against what she does not have if they come into her body. But if the husband is positive and she's negative, then the possibility of her getting sensitized is there. But if she's positive and the husband is negative, then there's no cause for concern because the husband doesn't have any antigen. So really there will be nothing to sensitize her. So it's of clinical importance when the woman is rhesus negative and has a spouse who is rhesus positive, or the rhesus factor status is unknown. Like Dr. Nome talked about a case now, somebody that had an abortion. Usually the reason why I've not gone into that is because of the kind of audience that we are speaking to. Usually when some ladies want to induce abortion, sometimes they may not know the rhesus status of the person that got them impregnated. And so they just do the abortion and then they just go. But erring on the side of caution is if someone has a miscarriage or has an abortion from somebody whose rhesus status is unknown, it's better to get program. It's always best to err on the side of caution so that you don't compromise your reproductive capacity and potential moving forward. So I don't know if that has answered that question.
Yes. So lastly, on this note, someone asks, so if a woman is sensitized, is there anything that can be done about it?
Okay. Well, I did say that once a woman is sensitized, she's been sensitized for life. Sensitized for life. The implication of that is that her body is going to keep producing antibodies against the rhesus factor. And so I don't quite understand the direction of the question, but I want to believe that what she's asking is there a possibility of this person having a child?
Yes.
I didn't go into the technical details, but it's important to say that rhesus sensitization, it can be mild, it can be severe. So there are some instances when the woman can actually give birth to a child, even though she has been sensitized. But then the effect of the sensitization will be on the child after delivery. So if that happens, what happens is that child needs to be taken to a center where they can offer the child quite a lot of care, other services that is really high tech in an attempt to try and manage the complications, because it can cause quite a host of complications to the child. The child can have what we call high output cardiac failure. You just get hematomas fluid accumulating all the organs of the body. So the kind of care that child needs can only be given in where you have quite not just experienced neonatologists, but where they have the facilities to offer that care. It's difficult to manage the sensitization itself. There is nothing that can be done about it really. So that is why it's best to prevent it from happening. This is where where the saying is quite apt: prevention is better than cure. It has a lot of relevance in this context. Thank you.
So what if both husband and wife are rhesus positive?
I think I've understand that, but just to emphasize, we only get worried if the wife is negative and the husband is positive.
Positive.
If the wife is negative, just for emphasis again, and the husband is positive, if both of them are positive, there is no cause for alarm. There's nothing to worry about.
He said, if the woman is Rhesus positive and the man is Rhesus negative, but the man's genotype is AS, why the woman is AS? Are there going to be any issue in the future?
Well, it's always good for understanding.
So it's just a combination of the two things we printed. Yes.
Yeah, it's always good to just separate both concepts and understand them independently. Then you can put them together. AS and AS has the possibility of giving birth to a child who has sickle cell anemia. That goes without saying. I'm sure I've emphasized that over and over again. Now, if the woman is Rhesus positive and the man is Rhesus negative, no, we've gone through this. There's no cause for concern as regards their Rhesus factor. But the concern is in terms of their hemoglobin genotype because of the possibility of having a child who has sickle cell anemia. I'm trying not to use the word sickler as you see it as being derogatory. So that's why I'm not saying it's sickler, but I'm sure that's commonly how we say it in the country.
Okay, thank you, Dr. Emmanuel. Thank you, everyone that made that time to be in this August acting, and I believe we've added more knowledge to the one we have already. And it's not just for us, it's for our neighbors, it's for our friends, it's for our families, it's for the church at large, it's for the society at large. There are so many people that are suffering out there because of this, because of the mistake made in the past. And we stand a better chance to prevent these things from reoccurring in the future. So I believe we've gotten this knowledge, and I believe we'll apply it in our lives and in our families and anywhere we found ourselves. So thank you.